Hello, I'm Dr. Celal Alioglu, aesthetic and plastic surgeon in Istanbul. Deciding to undergo a second nose surgery is not only emotionally difficult, but also it is not as easy as the first surgery. Revision rhinoplasty is not just fixing the remaining deformities. It is about restoring your confidence and often your ability to breathe again better. The most critical point is timing. You must wait at least 6 months to 1 year after your previous surgery. Your tissues need to be fully healed and soft. We treat patients with asymmetry, collapse, droopy tips, remaining deformities, or persistent breathing issues. However, we must be realistic. This is a reconstructive procedure, not a touch-up. Revision surgeries is more complex than the first surgeries. We are often rebuild the structures. Since your original cartilage may be depleted, we frequently use extra cartilage from your rib or ear. This allows us to correct deformities and permanently stabilize the nose. The surgery takes about 2 hours under general anesthesia. You will stay 1 night in the hospital and then your hotel. For our international patients, we require a minimum stay of 5 days in Istanbul. By 10th day, you can typically return back your social life. I have performed hundreds of these revision surgeries. It requires patience, experience, and ability. With this, a natural result is possible. Contact us to discuss your specific case. Thank you for listening.